In this video, we'll discuss about drug administration and various routes for administering drugs. As homeopathy bears a specialty and originality in the field of medicine, its route and mode of administration also bear a specialty. The subject that deals with the route of administration of drugs and medicines is called pharmaconomy. There are various routes for administering drugs into our body. They are oral, sublingual, topical, and parenteral. First, we'll discuss about oral route. It is the most commonly preferred route of drug administration. It was introduced by Dr. Hahnemann in the first edition of ARGHMC in the aphorism 252. The homeopathic medicines are usually administered singly and orally. The medicines given orally seem to act effectively and promptly. Hahnemann said that the drug should be laid upon the tongue and allowed to melt there. Homeopathic potentized medicines seem to require no digestion but are absorbed directly from the mouth and then act through the cerebrospinal or ganglionic nervous system. Coming to the sublingual route, it is adopted in case of thickly coated tongue which interferes with the absorption and action of medicines. For local actions, we use gargles. Gargles are solutions of drugs for local action in mouth or throat. For example, Phytolacca decandra gargle in case of acute tonsillitis. These two pictures shows the differences between the oral and sublingual route. In the first picture, the drug is placed above the tongue. In the sublingual route, the drug is placed below the tongue. It acts to the mucous membrane of tongue and throat. Coming to the topical route, it includes skin, mucous membranes of nose, rectum and lungs. Olfaction means act of smelling. It is a method of administering medicine to a patient through the nose and mouth by the act of smelling. Hahnemann administered medicines by oral route for many years, but in his last years he favored the olfactory route. He mentioned in the aphorism 288 footnote about the importance of olfactory route. Method of olfaction. For this, globules are moistened with the medicinal fluid and placed in a small phial. The homeopathic physician allows the patient to hold the open mouth of phial first in one nostril and in the act of inspiration draw the air out of it into himself. If a stronger dose is to be given, ask the patient to inhale the same vapor with the other nostril, more or less strongly depending upon the prescribed strength, which is mentioned in the footnote to aphorism 288, 5th edition of Organon of Medicine. If both the nostrils are stopped by the coryza or polypus, the patient should inhale the mouth, holding the orifice of the phial between the lips. Coming to the skin absorption, it acts through rubbing or friction. To the entire cutaneous surface of the body, wherever the epidermis is sound, we should rub the given drug on the skin. Example, application of lotions, ointments, liniments over the unbroken skin. Epidermic. In this method, drugs are simply kept in contact with the unbroken skin without friction or rubbing. Examples, plasters, poultices, ointments, etc. are thus applied. There are some other mode of administration of drugs in the form of drops. Examples, Cineraria meritoma succus. It is used as an eye drop. Mullein oil used as an ear drop. And sanguinaria is used as a nasal drop. Coming to the parenteral route. The drug is directly injected into the blood or tissue fluid using needle and syringe. These are of two types, primary route and intra-arterial route. In the primary route, it includes intramuscular, intravenous and subcutaneous. In the intra-arterial, it includes intracardiac, intraspinal, intracerebral, intraocular and intra-abdominal. Parenteral means other than enteric system, means other than GIT. Coming to the principles of administration. First, routes. Oral and olfaction method is satisfactory for drug administration. And forms. There are two forms, liquid form and solid form. In liquid form, medicine may be administered after being dissolved in greater quantity of liquid vehicle, thus it comes in contact with the much larger surface of sensitive nerves, mentioned in aphorism 286. Solid form. Medicine may also be administered in the form of medicated globules, sugar of milk or tablets. Doses. The smaller the dose of the homeopathic remedy is, So much the slighter and shorter is the apparent increase of the disease. It is better to give a small poppy seed-like globule soaked with the medicinal substance and then to serve it either by dissolving it in a small quantity of purified water or surface sugar of milk. We follow law of simplex. In the aphorism 274, it is mentioned that it is wrong to attempt to employ complex means when simple means suffix. Repetition of doses. Repetition may be continued till either recovery ensues or different groups of symptoms arise and thus demands different remedies, which is mentioned in aphorism 248. In chronic diseases, medicine may be repeated at intervals of 14, 12, 10, 8 or 7 days. In acute diseases, at very much shorter period, every 24, 12, 8 to 4 hours. In acutest diseases, for every hour, even at every 5 minutes, the dose is repeated. Proper time of administration of medicines. In intermittent fever, most appropriate time is immediately after the end of paroxysms. In menstrual disturbances, the best time is the post-menstrual period. Diets and regimens. Everything which can have any medicinal action should be removed from the diet and regimen of the patient during administration of medicine, so that the small dose may be overwhelmed and extinguished or disturbed by any foreign medicinal irritant, which is mentioned in aphorism 259. Some rules to be followed while administering drugs. Nothing should be taken at least half an hour before or after taking medicine. No new habits or addictions should be indulged in during the taking of medicine. All emotional stress and strains and excitements should be avoided. This is about the drug administration. Thank you.